Hello everybody and welcome to NQA's webinar on 45001 2018, the key themes, and trying to answer some of your questions that we received previously. As you can tell from the slides, I'm Terry Fisher. I'll be your presenter for this afternoon. If you've got any questions as we're going through, by all means put them in the chat box and we'll endeavour to either answer them as we go, or at the end there'll be a Q&A session. So without further ado, I'll start the presentation. Just to give you a quick oversight about NQA, we are a global certification body, and there's some information there on how we compare to other providers on a global platform. So we're #1 in America certification body for aerospace, including our colleagues at NTS, and we're top 3 in the UK, and we're China's #1 certification body for in the automotive sector. Just as some highlights there. So we also provide certification services and training services across a full range of activities and standards. So as you can see from there, there's a good range. And we have a range of courses that are currently being delivered primarily on remotely, but we do also deliver them when legislation allows at regional centres throughout the UK, and we can always set something up if there's enough demand in a particular area. So that's just a quick overview that we can do. We do virtual training, e-learning and webinars, in-house training, and we also do public training in nationwide locations. A range of internal auditor courses, implementation courses, lead auditor and internal auditor courses for all the various disciplines that we cover as certification. Just a quick overview about me. I'm Terry Fisher. I'm the lead assessor at NQA, covering not only 45001, but obviously 18001, 9001 and 14001. I also do EcoCampus, and I'm a member of IOSH. I've got a varied history in commercial background, so I spent most of my working career in industry, so I haven't been an assessor for that long, about 8 years. So just to reassure you, I have been in the real world and I do know what it's like to sit at the other side of the table being assessed. So firstly, I'd like to just give you an overview of what we're going to cover this afternoon in the webinar. So we're just going to have a quick look at the structure of the standard and Annex SL and the framework, the key concepts and benefits of ISO 45001, including the potential for integration, the importance and role of a gap analysis from OHSAS 18001 and the migration to 45001, practical guidance on some of the more complex clauses within the standard based on your questions, a quick look at how to plan and provide evidence during an assessment, and addressing worker participation and how this can be demonstrated. Some of the key themes that we're going to cover throughout this webinar. In terms of the webinar, so throughout 2020 and before, NQA have been running a series of webinars related to the migration of 18001 to 45001, and these resulted in a host of questions from the audience. So what we've done in this particular webinar, we also ran one in January and we took some themes there. We're trying to answer questions that are quite common, that come up in a repetitive way, both throughout our webinars, but also through my experience and other assessors' experience of audits and various questions that get asked. So you will find that these webinars, although there may be a similar title, as we go throughout the year, the content does change, so it will cover different questions, different answers, etc., depending on market needs and your questions to us. Just a quick prompt there. The withdrawal date for OHSAS 18001 is September 2021. So that sounds like an age away, but I can guarantee you it'll move quite quickly. And just to remind you that that is when 18001 will be withdrawn, and certification registration will not be permitted to that standard after that point, because it won't be a recognised international standard any longer. In terms of the ISO structure for 45001, it adopts the Annex SL high-level structure in the same way that other management standards have. It's broken down into 10 sections. The first 3 sections talk about the standard itself. So when it talks about scope, it talks about the standard, the scope of the standard, not your individual organizational scope. In section 2, it talks about normative references. In section 3, there's details about terms and definitions. So I would advise people, A, to have a copy of the standard available to them when they're looking at the migration process, and also look at the terms and definitions, because it just clarifies some new terms and definitions that have been introduced within the Annex SL framework. But the actual audited elements are from sections 4 to 10 inclusive. These are the bits that we will actually audit when we come into organisations, or audit them remotely or assess them remotely, as currently is the case. So it's sections 4 to 10 that are the auditable elements of the Annex SL structure, just for clarity there. So in terms of the concepts and the benefits of ISO 45001, primarily it's looking at enhancing and developing an improved occupational health and safety performance and culture within an organisation. It's looking at that culture improvement based on risk-based thinking and worker engagement. The term worker is used as it's an all-inclusive term, as opposed to staff or employee or whatever. It's all-inclusive because it includes contractors and all the different ranges of workers within the workplace. It doesn't exclude members of the public, by the way, just for clarity there. But so it's worker is used within the standard as the phrase to mean staff and employees, etc. The standard concept is looking at a systematic approach based on risk management to reduce culpability and provide enhanced levels of protection as the system matures and develops. It's also a mechanism to demonstrate leadership, have a systematic approach to managing action, and driving forward continual improvement within the system and the performance and protection of people and workers within the workplace. The importance of a gap analysis, just to clarify this point, within the migration, now this is purely for people migrating from 18001 to 45. If you're starting afresh with 45 and haven't got 18, a gap analysis is not a mandatory requirement. But if you are migrating from currently have 18 and you're migrating to 45001, a gap analysis is a mandatory item that needs to be completed before the recertification migration visit. NQA provides its clients with a template for this before the assessment to enable you to complete it and use it to aid your development of your system prior to the assessment. It's quite a good tool, is a gap analysis template. Whether you create your own or you're using NQAs, etc. It can be very useful in migrating or developing systems in terms of a checklist. It can help you clarify where you are, what you need. If there, as the name suggests, if there are any gaps between where you are and what you need, and it can also give you reassurance that you've covered all the requirements. So it's a very useful and important document in terms of a process to go through. We have a question on this. Do you need to provide evidence for a gap analysis, or is it okay to answer yes, no? As part of the migration process, we require that to be documented, and that's part of the IAF. It's not part of the standard requirements per se, it's part of the IAF's requirements to ensure that you've gone through the process of preparing your management system for the migration, and we require that to be documented. So hopefully that answers that question. So that would need to be both issued by us and completed by the client at the recertification visit. One of the questions that we often get asked is, how do we plan and provide evidence? And one of the biggest challenges that we've found in our experience due any assessment is knowing where the relevant information is within the organisation. I think it's fair to say a lot of organisations have a great wealth of information. It can be quite challenging under the stresses and strains of an assessment process to have all that lined up and have all your ducks in a row, so to speak. So the gap analysis can provide a meaningful prompt and structure as part of an evidence trail. So you can have your own version of a gap analysis to help you say, oh, right, that's there. Because there's nothing worse than being in an assessment and somebody asks you the question or asks you a question and then your mind goes blank and you think, oh, where is that? Or what have we arranged for that? Also, audit plans are provided to clients prior to the assessments to aid their preparation and resource planning for the assessment. Please use them and make note where the information is, who has access, and how this will be demonstrated. So think about how you can demonstrate how your organisation uses the management system and standard to deliver effective benefit. That's what we're trying to assess when we come on site. So we're not only looking at the system and the mechanics of the system, but it's about the real world effective delivery of that process. So you need to think about how you can demonstrate that and what information you'll need to help demonstrate that as we go throughout the assessment process. It seems obvious to say, use a gap analysis, use the audit plans. Just try and think about what does that clause, what does that element, how does your organisation address that currently? That's the way to try and structure your preparation for your audit. The other challenge that we're often asked is about demonstrating worker participation. And it can be demonstrated in a number of ways, through direct reports, reports from meetings, meeting minutes. So it can be documenting that not just, for example, the health and safety responsible person has conducted the risk assessment, but he's had support from participants of the operation and the activity, people directly involved in the operation as part of that risk assessment process. So documenting that in terms of participation within the records of the risk assessment itself can be very useful. Participation in hazard reporting. So obviously the number of hazards that get reported and records of those, if that captures who reported it, where and when, etc., that's very useful. This also underpins the demonstration of worker participation. Information and performance. You can turn around and say, we've had all these hazard reports, we've done this, and we can actually look at performance related, so a decline in a particular hazard reporting repetitive nature of hazard reporting for a particular item when a corrective action's been put in place. So that shows that effective worker participation and the effectiveness of hazard reporting to reduce risk and eliminate and be proactive rather than reactive. You can also use meeting minutes and records of all sorts of activities, both health and safety minutes. It could be policy review meetings, the whole range of things that an organisation may be involved in, and where different levels of workers are involved in that process. And of course, health and safety minutes and trade union participation and various things like that all help, and records relating to all of that all help demonstrate worker participation. And one of the key things is, from our point of view, is when we're out doing audits, we'll want to talk to operators. We don't just want to sit and talk to managers or whatever. Not that there's anything wrong with the management, but we want to actually get to grips with what it's actually going on within the operational areas of a business. So it's about looking at the operations and talking to the people directly involved. We've had a question, mandatory as regards I think it refers to the gap analysis. It's mandatory by the IAF, so it isn't a clause within the standard, but it's the International Accreditation Forum, which looks after the international standards on a global basis. It's a requirement for the gap analysis to be undertaken for migration to ensure that the clients are suitably prepared for the changes and the introduction of the ISO standard in terms of 45001. You've got to remember 45001 is the first ISO standard for occupational health and safety, hence why it's called a migration. It isn't an upgrade to an existing ISO standard. It is the first ISO standard. 18001 was an OHSAS internationally recognized standard. It wasn't an ISO standard. So this is why it's classed as a migration and not just a transition. Just having a quick look. Some of the questions there, making sure I'm covering them off as we go. So in terms of this webinar, we've got various questions that we've withdrawn from. Basically, when you submit questions as part of your question and answer sessions from the various webinars and things, we document those, and we then use them to give us a platform for our next webinar. That's so hence why it's very good for you to write your questions into the chat box as we go, because that gives us a basis for our future webinars, and also ensures that we're delivering the need of the individuals, not just what we want to talk about. It's about delivering your needs as clients to NQA. One of the questions that was asked about context of the organisation, where does it say in the standards 4.1 and 4.2 have to be documented? Well, it doesn't. However, a large number of organisations find it useful to document this in a number of ways. That aids it being circulated to relevant people, aids it being communicated in terms of understanding why the requirement is there, what the considerations are, so it can help awareness. And it also helps understanding the changes and that can impact the organisation and top management. So a lot of organisations do choose to look at documenting or have supporting documents in relation to clauses 4.1 and 4.2 for interested parties and context of the organisation. So it enables that connectivity of between the interested party and what they require from the organisation. The next question, how important would you say linking within the context the internal and external issues that affect the business and understanding where these issues can link to other areas within the management system? I think it's fair to say that the context of the organisation is really, really important. You could view it to some extent as the glue that connects all these various clause requirements together. It links workers and other interested parties with the organisation, what the organisation does, what it may want to do or what it needs to do for the future. So it may want to do something because of a strategic direction, or it may need to do something because of a statutory obligation or a compliance requirement. It would directly link to things like policy commitments, as I've mentioned, legal and other requirements, the strategy of the organisation, workers and the operations themselves, resources and technology, operational controls, and emergency preparedness, etc. So it really is an important element to consider, and it's the connectivity between all these elements, how things change, and how things impact the organisation. Just having a quick check on the There's a question here about internal audits. Basically, the question is, what, if any, requirements are there for internal self-auditing and what needs to be demonstrated? In terms of auditing, I will touch on it later in the slides, but there is a requirement within the clauses of the standard under section 9 of the standard to have both a programme of internal audits to say what you're going to audit and when, and also looking at the requirements of why you're auditing a particular activity, what's the reason, and that audit program needs to be risk-based. So it should also look at historic performance. So you should look at things that are important to you, or the system indicates that you've had, let's say, a checkered history in terms of effectiveness. So you may want to audit it more frequently. You've also got to consider risk-based activities, so that to ensure that if the controls were not effective and the consequences of that effectiveness were significant, i.e. it's likely to do considerable harm, then you would look at those things more frequently than you would look at something with trivial impact or lower levels of impact in terms of occupational health and safety. So it's trying to take a risk-based approach both to the requirements of internal auditing and also the frequency and what's to be covered within those internal audits. And it's a very good mechanism to do the review and checking of performance and various things, which we'll touch on later in the presentation. So as I've said, the context is really important. Sorry for bouncing about between one subject and another, but as questions come in, we obviously do like to answer them as they come up. So the context of the organisation is a really important element, and it's obviously subject to change. We've only got to think of recent events with the global pandemic, etc., how quickly the context of the organisation can change because of something that's potentially an outside influence, not something that the organisation has done or wanted to do. So it really is important of how that can impact on the organisation and how that can be used. So it's the awareness of that going forward is a key element, and it's a key difference with the introduction of 45,001 in relation to 18,001, because context of the organisation wasn't, although it was inferred, it wasn't really covered as a clause requirement. Question here on how would you create and demonstrate a risk and opportunities register? There's no required specific method within the standards or whatever to say how it should be done. However, it is common from my experience to see a table-like document, and the level of detail depends on the organisation, the resources, the culture, the technical knowledge, etc., and the maturity of the awareness within the organisation of that particular requirement. So risks and opportunities often are looked at in some form of a register, for want of a better term. you know, in whatever way. And it's not for me to say it has to be done in this way or that way. It's for us to understand we need to ensure as assessors that that is being considered, the context is being considered, and the risks and opportunities that are identified within the management discussions and the various things that apply to the organisation, and through conversations with leadership, etc., that the context is being considered and the risks and opportunities are being addressed suitably. And obviously these things are subject to change as the system matures and or external influences change the impact on the organisation itself. Excuse me, I'll just take a quick drink. So that brings us nicely on to leadership and commitment. One question that we've been asked a couple of times in previous webinars and various events throughout, it's clause 5.1. There's a requirement within the standard for leadership to protect workers from reprisals. And the one question that we often get asked is, how do you audit that? And one way to audit it is to have discussions, direct discussions with staff and talk to workers about incidents and reports and how things go and what's it like when they raise concerns, etc. Talk to union representatives, worker representatives, and operators directly. So that's one way that we can audit that. It's all evidence, you see, when we can turn around and report in our reports that we've had discussions with and they're confirmed, etc. And it's also reflective of the culture. We can also look at corrective actions and incident investigations and timings of these things, and that can help indicate the level of leadership and commitment and culture of the organisation. So we're using all these methods and all this information that's generated by the standards and the requirements of an organisation to indicate how effective it is and what the culture of the organisation is in relation to occupational health and safety. And again, the question here about, can I give an example of an implementation of clause 5.1? So I've used the clause as it states, protecting workers from reprisals under leadership clause, protecting workers from reprisals when reporting incidents, hazards and opportunities. An organisation may already have bullying and harassment and whistleblowing policies and procedures that could help to demonstrate this. So there's no reason why they wouldn't be invoked, whether they be part of the HR function or whatever, depending on how the company is structured. Could also be direct communications and communicated information, both in terms of induction, etc. This is what we expect, our expectations, what we want to promote, this leadership and commitment and this engagement. So there's various examples there of how we can see procedures and documented information and policies, how they can all underpin this culture of the organisation to protect workers from reprisals. A quick question here on internal audits. If you hold an OHSAS 18001 internal audit qualification, will you be able to use this to transfer directly to an ISO 45001 external auditor? I would say not. Primarily, there's a great deal of difference in terms of internal auditing and external auditing. Although you may be very experienced, and doing a course and having a qualification doesn't necessarily make you fully competent. So the standard doesn't define competence requirements for internal auditors, but certainly for external auditors and third-party auditors, there is an expectation of competence to comply with 17021 and various other requirements of external auditors that we would see a level of qualification and competence and experience to be able to provide that level of assessment. So the short answer is it may be useful to demonstrate a level of knowledge and application, but it wouldn't be suitable on its own and sufficient to demonstrate that you are a suitably competent and qualified ISO 45001 external auditor. Question there, where does the standard state that internal auditors training is a requirement? As I just said, there's no requirement for internal auditors within the standard for a formal qualification. So a lot of organisations, the standard does require you to define competence requirements for the various roles and responsibilities within the management system and operations. So some organisations choose to define it there, and some organisations will define it based on experience, competence of different applications, etc., and they define it in their own way. The standard does not define a level of competence requirement for an internal auditor for the system. It does require the management system for the organisation to define its own competence for roles and responsibilities within its organisation. Statutory inspections. One question that we've been asked, statutory inspections in COVID-19. Question is there any tolerance of office statutory inspections being delayed, not completed on time due to COVID-19? Technically, there is no tolerance. However, certainly within the UK, and I can only speak for the UK, the HSE have provided various bits of guidance, and I've copied a web address there. It's not a link, so when you get the slides at the end of this presentation, it won't work as a link, but there are various guidance documents and supporting information on the HSE's website within the UK as to the stance that they would take. But just to note there, it's down to organisations to provide a safe working environment for their workers. So you need to ensure that the equipment and the resources that are used within organisations is safe to perform the function that's required of them. So it is something that the organisation must consider quite robustly, and don't just take it as read that they don't need to do anything and use COVID as not an excuse, but as a reason not to have undertaken various inspections, etc. You still have an obligation, certainly statutory obligation within the UK, to provide that, and in a lot of other geographical locations globally, shall we say. And it's also the moral obligation of the standard itself. So whether it be a statutory obligation, the organisation has signed up to the implementation of 45001, so it should do what it needs to do to protect its workers. So that is also a commitment, and once that commitment's made, it should have equal driving force as a statutory obligation. So it shouldn't be used, COVID and various things shouldn't be used as an excuse for not for doing the right thing in the right place. We appreciate, there may be some technical difficulties in terms of getting inspectors into premises or whatever, etc. We've got a question on can performance be evaluated without the use of internal audits? In answer to that, yes. Performance can be evaluated in numerous ways in addition to internal audits. Internal audits are a requirement of the standard, so you would need to do internal audits, but you may look at performance reviews in terms of accident stats, incident stats, hazard reporting, absenteeism, suggestion performance, occupational health suggestions. All these things are ways of monitoring and evaluating performance. So yes, it's certainly not the case that internal audits are the only method. Review of evidence and information. We often go into organisations, and when you look at the types of reports that are being generated, etc., so they would lead you to maybe review particular activities or particular requirements. They may drive you to look at particular performance activities and just what people say to you. You know, somebody may make a suggestion or actually make a complaint. This whole part of worker communication, etc., is a key element. It's not just about doing internal audits, although internal audits are a very valuable tool in looking at various things and evaluating performance of, let's say, controls and whether controls are delivering the benefit that was intended. Question here is also about where is internal audits set out as a defined requirement. It's in section 9.2 of the standard. Section 9 in its overall clauses. A question here quickly on sort of corrective actions. Can you use corrective action process if tasks slip and operational control is seen to be less effective than it should be? Most certainly, yes. What you've got to remember about implementing corrective actions or improvement actions, whatever the terminology be, you've also got to remember that before you implement a change, you look at the potential risks and hazards that may be created by making that change. Because what you don't want to do is implement a change that addresses one issue and then creates potentially more issues or more significant issues of a different nature that haven't been foreseen within the risk assessment process. So it's always very important to risk assess before you implement change, and you can also see that within the management of change clauses within the standard, not just under corrective action. I asked about continual improvement, and continual improvement focuses on root cause, corrective action, etc., etc. I think this may be referring to other discipline standards based on Annex SL. And it's quite right that they do look at prevention. The key phrase of all of this is taking action based on information and addressing the root causes of the issue. So that's quite correct. But in terms of the clauses of 45,001, 10.3 is the clause, and it specifically focuses on enhancing OHS performance, promoting a culture that supports an OHS management system, promoting worker participation and communications, and retaining documented information as evidence so you can demonstrate those actions have been reviewed and implemented and suitably delivered what needed to be addressed. So yes, they do follow the same principles, but in 45,001, I would say they do focus on the enhancement of performance. And it's also worth bearing in mind that 10.3 is basically the last auditable clause of the standard, and it's deliberately put there because if you've done all the other clauses and requirements of the standard, continual improvement should be a natural outcome of an effective OHS management system, because you will do corrective actions and preventive actions, both in terms of hazard reporting and correcting hazards, accident reporting and correcting contributing factors to an accident. So you'll do all these things naturally as the system operates. So therefore, to some extent, continual improvement is a natural output of the rest of the clauses of the management system, because you're always looking to be preventative and trying to foresee risk and reduce risk, not just react to it. And that's a key message really in terms of management systems, is that they need to be as much proactive rather than just proactive. You don't wait till you've killed somebody to reduce the risk of killing somebody, is basically my message. So you do need to take, hence why we look at risk assessments and hazards and all these things and all the tools that are available to us, and safety behaviours and all the various things that can be used within occupational health and safety in terms of medical assessments and all these things to ensure that we are reducing risk of harm and injury to staff and workers throughout the process, not just as a corrective action at the end. So next question, how does an organisation determine what they are required to provide in terms of ISO 45001 documentation? Well, as you read the clauses of the standard, and I would strongly advise every organisation implementing and using 45001 OHS management system to have access to the standard. We do find on occasion that some clients don't have access to the standard, don't know the specific clauses and requirements, and it can be really problematic when we're trying to evaluate an organisation against requirements and the organisation isn't fully aware of all the requirements. It may have a perceived understanding, etc. And I'm not decrying that, but I would recommend all organisations to have access to a copy of the standard and its requirements. And within the standard, there are specific elements that are required to be documented. A few there, policy, objectives and plans, etc. It's really important that not only are these things stated verbally or whatever, but they also need to be documented, because you may need to distribute that throughout the organisation and externally, and also internally throughout the organisation. And also it can help people, it can help the effectiveness of delivery if someone has a plan rather than just a spoken word or a commitment that's verbal. So documented information is an interesting phrase because it includes all sorts of documented information, not just hard copy paper documents. It includes data, information, web, text, etc., etc. So it's an all-inclusive term, and it's used as opposed to just records and documents. So documented information is a phrase that is an all-encompassing term, and it is a requirement of the standard for various elements, and an organisation then needs to put that documentation and information in place so that operations can be suitably delivered safely and enhance performance over time. There's a question here about, is 45001 purely about workers and staff and health and safety, or is there any clauses about protecting third parties? It's people who may be affected by the occupational activity is the way the standard captures that. It doesn't mention members of the public specifically, but it talks about people who may be affected by occupational activities. So yes, it's a requirement about protecting people. And the whole of OHS is about protecting people, and that shouldn't be forgotten. I've seen some really excellent documented systems that have been quite poorly implemented. So although the system documentation is marvelous, the implementation and operational control, etc., doesn't necessarily measure up in the same way. And realistically, we're talking about how that actually operates in the real world and how that delivers benefit in the real world to prevent injury, ill health, including occupational health, including mental health and well-being, etc. So it isn't purely about the system and what the system requirements are, but it's also about how that's effectively implemented in the real world applications of that particular organization. So yeah, just to summarize there, so documented requirements are specific as defined by the standard, but it's also down to the organization to define its own, what it needs to document, why it thinks there's a benefit there. And, you know, assessors will ask to see this documentation. We need to see evidence of this stuff actually happening, things like risk assessments, etc. So we do need to see documented information and processes related to that. The standard is not specific, it just says key elements that must be documented, but it also gives a general requirement that other documented information must be suitably controlled, retrievable, legible, etc., so that it can be used for the effective delivery of the management system. Quick question on worker consultation and participation. How would you determine the adequate level of worker participation in defining the procedures? You may determine it in procedures, the frequency and types of activity that's going to be undertaken, so that can help, having them regularly enough so that they're effective, making sure you get engagement with the workers. And it's also about consultation, not just participation. It's actually asking opinions. So before something happens, do you think it'd be good to do this, do that? Even from the policy downwards, how we actually function, do you think that's the right wording for this policy? Do you think that's correct? This consultation and participation is fundamental to the effectiveness of the management standard application. And it can develop over time, and its effectiveness can only be really reviewed over time because it relates to feedback and performance and information that's generated over a period of time. So it really is a fundamental element of the standard to get this worker engagement. People engage are more, it's more effective to get people's buy-in and engagement with requirements when they've had an opportunity to participate in that, either via worker representation or via trade unions or whatever else. So it's really important to get people's engagement, and they understand the problems that they face on a day-to-day basis. So it's about this people thing and how you communicate effectively with people within your organizations. So there we go. I think we've addressed most of the questions that we've been raised throughout on a live session there. Obviously, the slides that we produced were based on previous sessions, so we will be using some of these questions for future webinars going forward. Just to give you NQA is there to help and support clients. So, you know, for NQA clients, we provide training support. We also provide regular health and safety news and legislation updates with blogs and website updates, and regular, like In Touch magazine that you can link to. We've got documentation to help you, both in terms of 45001 implementation guides, and we've also got a 45001 migration gap guide, and we also have an NQA associate partnership program whereby we can connect you with associate consultants, etc. That's not a recommendation of consultants per se, that's just that we have a program where we work with particular consultants, but it's not a recommendation per se. It's about we give you an option of a number of people that if you're looking for a consultant or need additional support, we can help you there. So there's various guides and information available to you from NQA. We work really hard to try and keep in touch and keep things relevant and live. We do advanced training courses in leadership with ISO, effective management of change, managing your supply chain relationships. So you can see all these things are indicators and supportive activities, not just to health and safety, but to management systems generally. Effective valuation of compliance, how to identify risks and opportunities, participation, consultation, demonstrating customer satisfaction, information security, GDPR, operational resilience, risk and process-based auditing, effective root cause analysis, etc. So there's lots of advanced training courses that we provide to support our customers and client base. So, from my point of view, are there any more questions that people need to ask? So if you've got any more questions, by all means, if you prompt them into the chat box now, that'd be really great. I appreciate some of you are on a time frame, so thank you for listening and thank you for your feedback. Very positive, thank you. So if you've got any more questions, by all means, like I say, type them in. Quite happy to spend a few minutes answering any final questions or anything that we haven't covered. This has been a whistle-stop tour of various questions. If you need any more support, by all means contact NQA and they can field questions directly to me and I can try and answer them directly with the organisations, or we'll put them in the next webinar. Just a further question in relation to the gap analysis. Now, the reason we want the gap analysis is to confirm that you have looked at your management system and to ensure that you've confirmed to your own requirements that you think you've complied with the requirements. The gap analysis there isn't a full-blown assessment. We'll go through the gap analysis with you to identify if you have any misunderstanding or misinterpretation, but it only forms part of that you've done the preparation work for the migration from 18 to 45. It's because of the context and organisation and leadership clauses within the requirements of 45 which weren't there, and the differences in requirements throughout the standard. So it's basically an enabling tool for you to go through a yes or no, etc. on that gap analysis document that's provided by NQA would be suitable and sufficient, because we will be going through the migration assessment with individual clients, but we just use that as a starting point to make sure that you've got that you've made those checks, because it can be very frustrating from our point of view if we get to a certain key element, let's say management review, and then the client says, management review, what's that? I haven't done anything. So it can be problematic. So that's the reason we want you to do the gap analysis. Thanks for that. So if that's everything from everybody, I hope you have a great weekend. It's Friday afternoon now, so certainly here in the UK. So have a restful weekend, keep safe, and look after yourselves. I look forward to working with you in the future. Thank you all then.